So first of all, the question about speed dating. I didn't have to address that with my spouse when I told him I was headed to Philadelphia by way of Harrisburg and PAEHI and CPA HIMSS Healthcare Summit today. In Pittsburgh, actually, we're working with a group of entrepreneurs and a bunch of gentlemen from CMU with an event called Innovation Happens. And basically, there's a lot of entrepreneurs that come out of CMU and the University of Pittsburgh that really have a lot of difficulty in getting in the door with all of the corporations in Pittsburgh. So we have something that we call speed demos. We do it once a quarter. We bring in 6 entrepreneurs. We set them up with tables, and they have 8 minutes to present their solution. And we bring in corporations from the city to take a look, get that preliminary introduction, understand what the solution is, and start to talk a little bit about, is there a fit? Is there something, does your solution have anything that addresses any of the problems we have as a corporation? So when Mark Stevens first approached me and asked me if I would participate from a sponsorship perspective, and he described it as speed dating, I thought, oh, I know what he's talking about. We just don't call it that. And so it's been a pleasure and a journey in being a member of the board, a more recent member of the board. And I've said this to Pam and some other members from BluePrint. This is an iterative process. This is the first time through. We're making it up as we go. And really, my point of view from an innovation perspective is innovation is a journey. My husband is from Montana. We have the pleasure of heading to Montana every summer. He is a big reader and loves all things related to Lewis and Clark. So we inevitably have to hear a Lewis and Clark journey story every year on our trip to Montana. We've learned about the gates of the mountain when they thought that they had reached the end. When you start to think about, as we all come together, so that payers, providers, really the end goal, where we're trying to get to, they were trying to find the West Coast. We're all trying to find what is the right patient experience. What can we do to get to the right quality and cost structure to make healthcare sustainable in the future? The trajectory that we're on is not sustainable. We hear about it every day from a healthcare reform perspective, as the victims of healthcare reform, the big, bad, ugly insurers. One of the other roles I have at Highmark, not only owning the innovation function, but about a year ago they said, and by the way, we'd like you to put together the Office of Healthcare Reform at Highmark. And so, while I acutely am aware of what the impact from healthcare reform is in 2014, 2016, really it's the convergence that I have seen between innovation and really what we're facing from a healthcare reform perspective. And certainly from the providers in the audience, there are a different set of impacts to providers from healthcare reform. I think we share the goal, again, of getting to a better patient outcome. The way the system works together, I wouldn't say it works together, it's disaggregated. There isn't a good member, my member, your patient, there's not really a good experience. We need to work at it from the perspective of what does that result in from a good patient outcome, but what are all the different tricks and tools that we can start to experiment with on the journey. Not everything is going to work, but we need to be able to accept course corrections and say, oops, I went down the wrong way and I have to turn around and come back and make some course adjustments, much like we're doing here from the Innovation Summit and what we're trying to do in terms of bringing innovators together with the hospital systems to look for solutions as we all walk towards this journey of what is the ultimate best patient experience. So that's my point of view from a payer perspective. I think we're all in it together. Well, some days it may not always feel that way. I think we have a shared view and goal really around the patient experience.